Hello everyone, Dr.berkkkaratas. Our topic is post-ejaculation, whether it's from masturbation or intercourse, or some discomforts that develop after ejaculation in your nightly habit, such as abdominal pain. We will talk about the causes of flu-like symptoms and concentration issues. Of course, what I'm not talking about here is if a person is engaging in inappropriate relationships or inappropriate masturbation, for example, 10 times a day or 5 times, or if someone is masturbating 2-3 times a day, then they will already face some problems on their own. We're not talking about that. What I'm referring to is we're talking about complaints that arise in individuals who engage in appropriate masturbation once or twice a week, or those who have suitable sexual intercourse or ejaculate in their nightly habits. Now, regarding this, Waldinger and his colleagues have done a lot of work on this. Really, they refer to it as a condition that develops after ejaculation. This is known in English as post-orgasmic syndrome. This is a condition known medically, but this disease hasn't made it into the textbooks. So if you pick up a book or a magazine, you won't find anything related to this disease or anything about this syndrome. And the biggest reason for that is actually when a person goes and says, after I ejaculate, I lie down for 1, 2, or 3 days, I have a fever, my nose is running, I have flu-like symptoms. Usually these patients are questioned without any further inquiry. They are directed to believe that this is either a psychological condition or a psychiatric condition. Of course, Waldinger has also been focused on this. So is there a scientific basis for this not being the case? He has thought about this. What has Waldinger thought? Just like in rheumatism, even though there seems to be nothing wrong, inflammation occurs in the joints, as you know. In rheumatism, could this also be the case? This is the body. The fluid we expel is also called semen. We refer to the fluid that comes out in sperm as a... Is the body reacting to a substance within it? So, in short, is there a situation that resembles an allergy? It started with a prejudice and ultimately obtained a number of results. Here, he established 5 criteria to be able to say that this disease exists. The first criterion, the complaints we are talking about here, such as concentration problems, memory difficulties, fever, sweating, muscle pain, need to be present either one, several, or all of them together. At least one of these complaints must be present. This is the first criterion. The second criterion, these complaints need to start immediately after ejaculation, that is within seconds or minutes. The third criterion needs to occur after almost every ejaculation. So if it happens only once a year, we can't call it a syndrome. It needs to happen every time. And this is the most important part. This symptom needs to last for about 2 to 7 days. So I ejaculated about 15 to 20 minutes ago, something like that. My blood pressure dropped. I had something. It lasted for 15 minutes. No, it's not. He says that in his patients, this lasts on average for 5 days, within the range of 2 to 7 days. And finally, this condition needs to resolve on its own without any intervention. If these 5 criteria are met, it is called post-ejaculation. We can call it a syndrome. Of course, which of the complaints is the most noticeable here? Concentration problems are the #1 complaint, appearing in 80% of the cases. Extreme fatigue has become history quickly. This has become history quickly, of course, because it was translated from English. But actually, this is somewhat related to premature ejaculation. So in patients who ejaculate early, these complaints can also occur, to be honest. 78% have fever and chills, 44% experience burning in the eyes, and 33% have a runny nose. So in this area, flu-like symptoms are really the least noticeable, but concentration problems are the most common. Okay, Waldinger said that, what did he do next? So if this allergic condition develops on its own, then just like with hay fever and other pollen allergies, a desensitization method is used for this. He said, I'll use this too. What did he do? Patients own from sperm fluids. An amount is very small, like 1 part in 40,000 or 1 part in 20,000. He took samples, took fluids, administered subcutaneously, and gradually increased the dose. Of course, this procedure lasted for 2 years. In the first year, he had this done twice a week. He did it once every 2 weeks. Then gradually he increased the intervals. op.dr.berk. He did it once a week. He increased the amount given, and he did this. So in the second, he did it on the patient. And in the end, he saw this in 60% of the patients, in 60% of one patient, the complaints disappeared in 90% of the other patients. And Waldinger said that this kind of sensitization could be addressed. He also mentioned that this situation could be resolved for patients who meet these criteria with the program. Well, Goldmeyer and his colleagues also said that there is indeed such a method. We can do this, but it's a method that takes a very long time. It needs to be done under certain conditions. It takes 2 years. These people are already in a state that resembles life in a troubled situation. They also tried something like this. They said for 2 patients, 1-2 hours before ejaculation, since this is allergic or autoimmune, we can suppress it with medication 1-2 hours before and after ejaculation. For 2 days, anti-inflammatories, diclofenac. This is very easy to find. A substance sold in its raw form every summer. They gave medication. And as a result, one of the 2 patients improved by 80% in terms of complaints. It had no effect on the other one. I wrote that it can be tried here. For this reason, if you really meet these criteria, the other sensitization, that is the desensitization program, is a very long program. It can really be tried. So, as you can see, here it has a success rate of 50%. This is not a success to be dismissed. The number is very small, but that's okay. It can be tried. Honestly, I prefer to start with this for my patients. For patients who meet this criterion, if it doesn't work, a desensitization problem can be addressed. This situation is quite important because some people are avoiding relationships for this reason. They are not getting married, or they don't engage in sexual intercourse when they get married. So this situation really needs to be resolved. If you also meet these criteria, make sure to consult a biology specialist. Thank you for the treatment.